Dr. Peter Hotez has been one of the leading science explainers on cable news and public radio during the pandemic and beyond. He squeezed in those TV appearances while working on a free COVID-19 vaccine that was distributed to developing countries. For his efforts, Hotez and a colleague were nominated for the Nobel Peace Prize. But Hotez was also a target of an anti-vaccine movement that he argues has morphed into a dangerous force in our politics and a threat to American lives. Hotez makes his case in his new book, The Deadly Rise of Anti-Science, A Scientist's Warning. Our wide-ranging discussion touched on Hotez's contacts years ago with Robert F. Kennedy Jr., his uncertainty about the future, and why Hotez has dedicated his 40-year career to finding vaccines that save lives. This is an edited version of our conversation.
Ever since I was a kid, I wanted to make vaccines. I thought this was one of the highest expressions of science for humanitarian purposes. And so I did my MD and PhD at Rockefeller University, used to be the Rockefeller Institute for Medical Research and Cornell Medical School, and actually started making a hookworm vaccine for a parasitic disease affecting hundreds of millions of people. Now, 40 years later, that vaccine is in phase 2 clinical trials and looking really good. So the point, and then we turned that program around to COVID and made 2 low-cost COVID vaccine technologies that reached 100 million people in India and Indonesia, providing proof of concept. You don't have to be a big pharma company to still do big things. And that was always part of the plan. I'd always wanted to make vaccines for the world, and that's what we're doing. I think the unplanned part was having 4 adult kids, including Rachel, who has autism and intellectual disabilities. And if you remember, that was the original assertion from anti-vaccine groups, that vaccines cause autism. And then I'd written the book, Vaccines Did Not Cause Rachel's Autism, that unfortunately made me public enemy number 1 or 2 at the anti-vaccine groups, but it also gave me a front row seat to this whole thing.
And it did, and that's something many people who may have seen you on cable TV, other venues, don't know, that you didn't just show up when the pandemic happened. You've been working on vaccines before, but also you've dealt with the kind of anti-science you're talking about now. And in the book you write, you made a decision. If I don't stand up for vaccines, who will? That's
right. And it started, with Rachel. I said, look, here I am. I'm a pediatrician. I'm a vaccine scientist. I'm making vaccines for the world. I have a daughter with autism. I can explain why vaccines don't cause autism, and really go into a deep dive into this. And I felt, look, there was a vacuum. Nobody else was speaking out, and felt compelled to do it. And I find it meaningful to be able to convince people of the importance of getting vaccinations and why vaccines are safe and effective.
How did the reaction to that book prepare you for the pandemic that came just a few years later?
Well, it started, because a lot of these anti-vaccine groups, what they were doing was they were monetizing the internet. They were selling phony autism cures, nutritional supplements that nobody needed. They were selling anti-vaccine books on Amazon. If you go to Amazon.com and type in the word vaccinations, almost all anti-vaccine conspiracy books. So I began interfering with the bottom line. This had become a part of the health and wellness industry, and I was hurting the business line, and so they were very aggressive and started targeting me. But then something else happened, which was about 7-8 years ago, maybe because we were taking some of the wind out of the sails around the phony baloney around autism. They got adopted by extremist elements of a major political party, of far-right extremism here in the United States. And so now it wasn't just going up against non-governmental groups monetizing the internet. This was actually going up against major political forces. I mean, I had Steve Bannon publicly call me a criminal, which was pretty extraordinary, and that sort of thing.
And was that the time when you first met Robert F. Kennedy Jr.?
Well, I started speaking with him back in 2017 because if you remember, after when President Trump was being inaugurated, Robert F. Kennedy Jr. came out and said he'd been appointed the head of Vaccine Commission. So I got contacted by the leadership of the National Institutes of Health, said, look, Peter, you have a daughter with autism. You can explain why vaccines don't cause autism. Would you mind please talking with RFK Jr.? We'll have it moderated by a third party. I said, sure. And started having a series of discussions with him by phone.
All in private?
Yeah, all in
unpublicized.
private with the third moderator, and I would do long walks and on cell phone. Sometimes my wife would be listening, Ann would be listening, and they weren't very productive, unfortunately. You know, he kept on moving the goalposts. It was, you know, first he said it was the measles, mumps, rubella vaccine that caused autism, then thimerosal preservative, then it was spacing vaccines too close together, then aluminum vaccines. Then he'd go on a tirade about HPV vaccine for cervical cancer and other cancers. He said it was causing autoimmunity, or, you know, all this stuff. And so you wound up, I don't know what the metaphor you want to use, playing this kind of pair game of whack-a-mole. You knock one down, another one would pop up, or, you know, always moving the goalposts. So it became an exercise in frustration, probably for both of us.
And then just this past summer, he's back again in your life. Joe Rogan offers, what was it, $1 million?
And now he's running for president, right? So, yeah,
to debate him on Joe Rogan's show, you refused. It became kind of a media feeding frenzy.
Yeah.
Is there anything you second guess about what happened this summer and how it affected you and maybe your cause?
No, I mean, I think, well, there were two reasons for not debating him. One is, for the reasons I just said, that it was an exercise in frustration. He wasn't interested in listening. He didn't want to follow the science, and, you know, he would just keep on making up new things, and so that was a source of frustration. But the other point, which for me I think is very important, I think it would send the wrong message for young scientists, because we have a way of doing science, right, that works. That's been very effective. We write up our findings, we submit them for peer review, they undergo major revision, sometimes it gets rejected, we present our meetings at scientific conferences in front of our colleagues who give us critical feedback, same with grants, and it's a system that's worked for over 200 years. It's not something that's up for debate. I can't think of any instance where we've really advanced science through a public debate. I mean, you had historically, you know, Einstein talking to Niels Bohr, which were two colleagues that respected each other, engaged in a public discussion, but not really a debate. We don't debate science. And as I like to say, you debate 18th century Enlightenment philosophy about Rousseau and Bishop Berkeley, or you can debate politics. But science is not something to debate, especially with someone who has no special knowledge or qualification.
There's a chapter in the book titled Red COVID that really resonates in Arizona. We have one of the highest COVID death rates in the country. What is red COVID? It's not a scientific term, it's your term. What is red COVID?
Well, actually, a term, it's not my term. It came from an article written by David Leonhardt of the New York Times, and you know, I agreed with it, and it's based on real data. This is an analysis that was started by Charles Gaba, the health analyst, but it's been reproduced by the New York Times, by Axios, by National Public Radio, and tragically it shows that after vaccines became widely available in the spring of 2021, March, April, May 2021, almost all of the deaths were among people who refused to get vaccinated despite the availability of vaccines. And it was very much along a partisan divide. Almost all of those deaths were in red states, red being Republican, blue being Democrat. And the redder the county, the lower the immunization rate, higher the death rate, hence the name red COVID. And it's tough to talk about, right? Because our training as physicians and scientists says, you know, you ordinarily don't talk about Republicans and Democrats and liberals or conservatives or red states or blue states. But the numbers are so striking, it's hard to avoid. And the point is, this did not happen because, Brahm, this did not happen because of misinformation or the infodemic. It happened because of a predatory, targeted, deliberate disinformation campaign that came from, unfortunately, the extremist elements of the Republican Party. It's not that I care about your political ideas. That's your business. That's your right as an American. But how do we, and this is the hardest part at all, how do we uncouple the anti-science from this to say, look, you know, you're entitled to your political beliefs, but don't pick up this one because it's going to kill you. And it was so tragic to watch this happen.
Okay, so I'll ask you to answer your own question. How do you do that? How do you uncouple it? There's a generation of scientists working now, future scientists, that probably needs to know.
Yeah, and I'm about to give you the longest, I don't know the answer to your question answer I'm going to give, because the health sector, the scientific sector doesn't know what to do. I mean, we can certainly do things to talk to the heads of the social media companies, maybe switch up computer algorithms so things don't go as viral. We can try to up our game in terms of amplifying, positive health benefits of vaccination and information, and that's what everyone's trying to do. It's only getting us about 20% of the way there because there is this predatory disinformation campaign. And now it's not stopping. Now that after ultimately 40,000 Texans needlessly died because they refused the COVID vaccine during the Delta BA1 waves in 2021, 2022, 200,000 Americans died. 200,000 Americans died because of anti-science aggression, which is what I call it. And now that that's happened, it's not like there's this pause for self-reflection. What you're seeing is those same predatory groups are doubling down. Now they're trying to say it was the vaccines that killed Americans, which is absolute nonsense. Or they're trying to say scientists invented the virus. And you're seeing this play out now.